House lawmakers must agree on raising the national debt ceiling today, or the U.S. could default on its debt as soon as June. Treasury Secretary Janet Yellen warns that could set off a financial crisis. The U.S. has never defaulted on its debt, which is currently more than $31 trillion.
Good afternoon. My name is Romina Casanova, and as Maureen Green, reporter for CBS News, just mentioned, the U.S. is facing $31 trillion in debt. This prompts the question, what is the U.S. spending so heavily on? The Office of Management and Budget provides the answer with the following infographic that shows the total spending in the fiscal year 2021, which was $7 trillion. Now, as we can see in this infographic, two main sectors absorb most of those $7 trillion. The first being Social Security, and the second being Medicare and health. Despite spending so much money on Medicare and health, there are still 24.6 million Americans that are left uninsured without access to this Medicare and health, as an estimate by the Health and Human Services. This issue needs to be fixed. The healthcare crisis in the United States is not an issue that lacks complexity, but rather lacks advocacy. And this led me to develop the research question: within economic and social parameters, why should the United States utilize single payer as a healthcare system to achieve universal healthcare effectively? With the research that I've gathered, I've come up with the conclusion and argument that the U.S. should not utilize single payer as a healthcare system because it will place a heavy burden on the economy. The medical field is not prepared for universal healthcare, and the patient will not actually receive benefits from a single payer. To begin this discussion, we must talk about the state of the economy. The state of the economy can be described as in recovery because it faced so many losses in COVID-19. Nick Popley of Times Magazine, located in the Washington, D.C. Bureau, writes about the inflation of daily commodities. For example, eggs have risen 138% in price, butter has risen 44% in price, and flour has risen 39% in price. Now, oil and gases are another place where you can see inflation. Ben Castleman, former chief economics editor of the data journalism website 538, and Clifford Krause, current economic chief editor of the New York Times in the Buenos Aires and Toronto bureaus, both write about how inflation has been one of the methods of recovery from the product shortages and health guidance complications that came from COVID-19. And we can see this graph here and follow the red line, which indicates the U.S. And look more closely at the years 2020 and 2021. We can see how oil prices have been rising ever since then. Now, since we're already dealing with inflation, we must look at an estimate as to how much single payer is going to cost. Scott W. Atlas, who investigates the role of government and the private sector in healthcare access and quality, provides us with the following quote: independent estimates for single-payer healthcare for California alone come about to be $400 billion. That is double the state's entire annual budget, and massive taxes will be required to actually fund this system. If we look at a side-by-side comparison of California and the U.S., we can see that it's going to be economically unfeasible to fund single-payer. California has a population of 39.5 million, and estimates come around to be 400 billion, as mentioned in the previous slide. However, the U.S. has a population of 331.5 million citizens, and estimates could reach up to $3 trillion. This could lead to a negative effect in the economy. Furthering this discussion, we must talk about the medical field, since it is heavily perpetuated by whatever changes are made in the healthcare sector. Paul J. Fieldstein, professor at the Marriott School of Business in the University of California, Irvine, provides the following quote: one of the main problems of a single-payer system is its reliance on rigid budgets, which results in the demand for healthcare exceeding the supply. That, in turn, leads to rationing of care, forcing people to wait. Now, such wait times have already been seen in existing single-payer models. If we turn to Canada, neurosurgery patients wait 8 months for surgery. In the United Kingdom's National Health Service, it has 4.2 million people waiting to receive treatment. To say the least, we are not prepared for the large pools of patients that single-payer is creating. And the most clear example of this is COVID-19. Nishito Duraman, expert medicine resident in the New York City Hospital St. John's River, writes about the patient surge that they faced in their hospital during the COVID-19 pandemic. Rahman comments how they had to exponentially increase the amount of intensive care units that they had. They had to put up tents to handle the patient overflow, and they had to convert surgery units into more intensive care bed units. Not only that, there were more drastic changes that had to take place in the hospital due to the large amount of people that were visiting the hospital daily. In other words, the medical field was overwhelmed when it saw large pools of patients in COVID-19. Lastly, when we're talking about single-payer or healthcare system overall, we must talk about the patients, the ones that are receiving care. However, the issue is that single-payer creates a lack of care. The reason as to why there is a lack of care is because there's a lack of medical professionals. The Association of American Medical Colleges provides the following infographic. If we turn to the bottom right corner, we can see estimates for the years 2020 and 2025. In 2020, there was a negative net loss of 90,000 practicing physicians, and estimates for the year 2025 show a net loss of 130,000 physicians. This, however, is not compared to what the UK is currently facing. The Guardian writes on March 2nd, 2023, how across England, 1 in 10 nursing posts are lying empty, and how 1 in 17 doctor jobs are also vacant as well. And so the last thing that trickles down towards the patient is resilience. According to the College Board stimulus, the dark side of resilience is defined as a psychological capacity to adapt to stressful circumstances. And what resilience causes is extreme resilience could drive people to become overly persistent with unattainable goals. What does this mean? This means that patients will have to become overly resilient, still waiting for things such as receiving treatment or the rationing of care that was mentioned earlier. Now, 2 solutions can be derived from this discussion. The first relating to single payer. Setting up timeframes as to when we want to recover can fulfill a successful implementation of the single payer system and avoid economic and social crises. The limitation, however, is that the healthcare crisis can become irreversible and it might be too late to turn to single payer. Now, if the US wants to explore other options, it can actually revisit old plans, because it could be a more viable option for the time being. However, the problem with this solution is that revisiting old plans can be seen as unpopular amongst the people. Thank you. Here I'm more excited and I'm open for questions.
First question, how valid and reliable were the sources that you used, and how do you know?
So most of my sources came from academic websites such as EBSCO and Gale, and not only that, I looked at the authors who wrote these sources, such as Clifford Krauss, which was a former chief economic writer for the New York Times, or Ben Castleman, who is a current chief economic officer in the data journalism website 538.
All right. What advice would you have for other researchers who consider this topic?
So the advice that I would give is creating a pros and cons list for single payer, because throughout my research, I found that there's a balance between the two. However, I chose to side with the one that I feel most comfortable speaking. And so looking at what options they have regarding research is a good idea to do.